Well, this is a really disturbing finding. If you look at the prevalence of hepatitis C, it was really decreasing quite a bit through 2010. And since 2010, it's starting to rise again. And we're seeing it in a young population, unfortunately frequent women in rural areas. It's part of the opioid epidemic. So generally these were people that were treated with opioid narcotics for acute pain. They became addicted to those medications, and nobody then would refill them or treat the addiction to get them off of those medications. Many of these people were under or uninsured as young people, and they resorted to using heroin, which was much less expensive, more readily available on the street, but unfortunately it's also injectable. So they went from oral prescription opioid narcotic pain pills to injectable heroin. A fairly quick leap that a lot of addicts don't do for many years. They'll use other medications. So it's unfortunate this young population that's getting infected, they don't know about the risk factors, blood-to-blood transmission, they're sharing needles, they may not have enough money, and we're seeing this group of women also becoming pregnant during the time while they're still using, and we're seeing actually a higher chance of passing the infection from mother to baby, generally at birth. So it's a real public health problem, but it's complicated, because there's a bit of a pushback. Nobody wants to introduce needle exchange programs, and some conservative, very rural areas. Inner city clinics usually have these programs available, but I think this is an area and regions of the country too that don't have a lot of support, and a lot of it is education about this population too. Absolutely, absolutely, unfortunately. So it is this sort of special population, but if we're not addressing the opioid epidemic at the same time, we're going to continue to have this issue. And also risks of HIV infection as well, and other diseases infectious diseases that go along with injection drug use.